Hello, this is Dr. Mohit, and today we'll be discussing about some porphyrias, and specifically Porphyria Cutanea Tarda. Alright, definitely the name is pretty complicated, but yes, I promise you that this topic won't be because of the amount of hours I put in to make the content. Yes, jokes aside, definitely we will be looking on to it, and I make sure that I make the topic very easy for you guys. Yes. Just to get a reference, this topic is from biochemistry, from the heme chapter. Yes, and in all the porphyrias, the one which we are going to read, that is the Porphyria Cutanea Tarda. This is the most common one. All right, this is the most common one in all the porphyrias. Okay, and if anybody could answer me that which is the most common acute porphyrias, yes, I hope you got that right. The acute intermittent porphyria, that is the one which is the most common one. Okay, we'll be making a list, and I'll write down everything in that as well. Okay, so first, to get your orientation right, how I want you to think about this chapter is, first of all, we have this biochemistry link, right? Yes, so in this, what's going to happen is there's going to be one enzyme deficiency. Okay. Alright, and because of this enzyme deficiency, what's going to happen is the product, we will have an accumulation of some particular product. Yes, we will have some accumulation. Okay, anybody know what that is? It's in the name, right? It is the porphyrins. So I hope this word porphyrin is not new for us, because even in our previous lectures, right, we had this porphyrin. These are the ones who impart color. Yes, porphyrins. Okay, all right. And because of this, right, they are also photosensitive. Okay, and that is the reason the person has the manifestations over the sun exposed areas. Okay, so just giving a little bit of overview, we will be discussing about all these points subsequently. So it is just a brief overview about this chapter, how I want your head to be oriented. So that is about porphyrins. And what's going to be the problem, right? The problem is going to be in two areas. Yes. Problem first, the first thing, we will have the skin manifestation. Yes, and the second problem, because of the heme synthesis, we would have hepatic manifestations as well. Okay, alright, so now you have the orientation about this chapter. Yes, so now I just wanted to get your attention to this one flowchart. Yes, a pretty easy looking one, right? So we just focus on the ending part, that is the heme. Yeah, in the production of heme, this is the enzyme. It is causing all the mayhem, which is absent in our patient. That is the Uroporphyrinogen Decarboxylase. Short form we will be using is UROD. Okay, alright. That is the one we'll be using it. Okay, fine. So let us just begin with our chapter. Yes, so the first point, yes, what is the deficiency about? Yes, the deficiency about the enzyme, that is Uroporphyrinogen Decarboxylase. Alright, okay. So, being taken care of the main point, yes, that we have to focus over here, that is, if you don't remember anything in the chapter, it's absolutely fine. But if you don't remember this one point, there will be problem. Okay. Okay. So URDO is the guy which is absent in this chapter. Okay. How are the manifestations? So it is acquired 80% and it is autosomal dominant 20%. Yeah. How it is acquired? What are the risk factors? So what do you think could be the risk factor for this? One of it is the HCV infection. HCV infection. Okay. Alcohol, smoking, and estrogens and high estrogenic level are proved to have risk factors to having Porphyria cutanea tarda. Okay. What is the last one? The conditions, that is the hemochromatosis. What happens in that? I'm giving you a moment to think. What happens in that is there is iron overload. Yes, this could have a predisposition to having this Porphyria cutanea tarda. Alright, the answer is iron overload condition, that is iron. Okay. Alright, so now we are just done with the risk factors. Now comes the interesting point. Okay. If you give me your next 5 minutes, I'm pretty sure I'll make this topic one of the most easiest one. Okay. So let us just begin, starting with one example, the pharma link. Okay. There is one particular class, that there are a lot of classes in pharma, but one particular class, that is, these are the P450 inducers. Yes, for example, in our case, we are just mentioning about the barbiturates. So yes, now we have the barbiturates, right? So barbiturates are inducers for 450, P450 or cytochrome P450. Okay, all right, and because of this cytochrome P450, right? So in this there is a part, yes, where heme is required. Okay, heme is a constituent of this, and because of this they are inducers. So there is depletion of heme. Yes, consumption of heme happens. That is the reason. Yes, because heme is less. Yes, the free heme is decreased. Heme is less, and there is loss of negative feedback. Why there is loss of negative feedback? Yes, and which is the enzyme which is a regulator for this? That is the ALA synthetase. Okay. Okay. So the ALA synthetase, right? This is the rate limiting enzyme for heme biosynthesis. Okay. So what is happening is because of the barbiturates, yes, it is inducing the P450, and the P450 is consuming all the heme. And because of this consumption, yes, there is no free heme. Yes, and because of that, because there is no free heme, we are losing the feedback, the negative feedback. Yes, we are losing the negative feedback. Okay. When would this work? Is because if heme was abundant, yes, and then this enzyme would not have been stimulated. Simple, right? But now when the heme is gone, the free heme is gone. That is the reason this ALA synthetase is being promoted. Yes, so there will be more and more ALA synthetase. So that is the reason we would have more heme intermediates. Yes, and one of the byproduct in this is the topic, that is the porphyrins. Okay, alright. I will go over this topic 2 more times, yes, so that everything is very clear in your mind. Yes, there should be no sort of confusion in any of the point. Alright, because of that there would be accumulation of heme intermediate, and we would have these exacerbations of porphyrias. Okay, fine. Once again, I'll just tell you the whole thing. If we give the barbiturates, what they do is they increase the P450 enzyme. Okay, and because in this P450 enzyme, right, there is a part where heme is used. Yes, in them the heme is used. So suddenly because of the drug, what is happening is the heme is used a lot. The consumption of heme increases. Yes, so obviously the free heme decreases. Yes, it's very obvious. Yes, so do you think what will happen to the ALA? Yes, ALA, we will lose the negative feedback. Yes, because why? Because there is decrease in heme. Because there is decrease in heme, it would be very obvious that ALA, because it is a rate limiting enzyme for the heme synthesis, it would be produced more and more and more and more. Simple, because it is produced more, we would have these porphyrin intermediates, yes, which would be aggravated. Yes, that is the reason we would have, at the end, we would have this acute porphyria attacks. Alright, that is one whole thing. Okay, one more time. Yes, one more time. I just want you guys to be very clear with this. Okay, so one question before we just start revising this one topic, that is, what do you think, which drug we should not give to patients who are having these conditions? Definitely P450 inducers we would not give. Okay, simple. Okay, so let us just revise this one more time. Okay, we explain this by the example of barbiturates, that is a P450 inducer. Because of this P450, what is happening is the consumption of heme is increased. Because the consumption is increased, so the free heme is decreased. Okay, and because of this we lose the negative feedback on the ALA synthetase, that is heme that is required for the heme synthesis. Okay, and as the ALA is increased, so what is happening is the porphyrin intermediates, these are increased. Okay, as simple as that. Okay, alright, so barbiturates, if given P450 and there is consumption of heme, we would have loss of heme, right? The negative feedback is lost, because if there would be excess, then this won't be stimulated. Now it is gone, the heme is gone, the free heme is gone. That is the reason this would be stimulated more and more and more and more. If this is stimulated more, then these porphyrin intermediates which are there, these porphyrin intermediates, they increase, and then they have all these symptoms. Which symptoms? These. Okay, so I hope I made myself extremely crystal clear and there should be no doubt anywhere. Okay, alright, so we go on with the manifestations. Okay, so skin manifestations and hepatic manifestations, two are there waiting for us. Okay, so first of all, we discussed this, right? So these porphyrins are photosensitive, so there would be blisters on the sun exposed areas. Okay, simple, on the sun exposed areas. Okay, alright, mainly on the dorsal region. Definitely, that is where we have a repeated exposure of the sun. Okay, and because so what is happening is, therefore, accumulation of porphyrins are, what was the word I used before? Yes, if you remember, yes, I do use this word 2 times. Yes, we would, because of the nature of these porphyrins. Yes, these are photosensitizing. Okay, and we would have hyperpigmented skin. Okay, alright, so we are done with that. We would just zoom into the image. Alright, we see in this particular patient, we see like there in the skin, it is these lesions you see. Yes, right over here. Definitely these are not the active ones, because there is crusting which is formed. Yes, these are not the active lesions. And also on the nail finding you see, yes, these nail findings, there is deposition of the porphyrins. Okay, alright, and the second manifestations, yes, we have over here are the hepatic manifestations. Okay, so what would happen is the liver enzymes, AST and ALT, they would be increased. But why are we talking about this is because they are pre-exposed to having 𝗏𝗔𝗃, okay, and cirrhosis. That point is coming next. Okay, so these patients are pre-exposed, of having this. So there is mild elevation in the liver enzymes. Okay, and as we discussed, there is increased risk of 𝗏𝗔𝗃 and cirrhosis. Okay, first of all, this point. Yes, even though the cutaneous manifestations are enough, yes, but still biochemical analysis should be done just to rule out. And what would we find is definitely the porphyrins will be elevated. Yes, definitely the porphyrins are elevated. So total plasma porphyrins are increased urine porphyrins, and decrease uroporphyrinogen. Yes, so that is the whole reason the whole mayhem is happening. Yes, and we have this hepatic manifestations, that is what the AST and ALT, right? They are increased. So what do you think the treatment is going to be? So what is the problem? Is the URDO is deficient? Yes, is deficient, and in the blood we have excess of porphyrins. So the only way to remove this excess of porphyrins is by phlebotomy. Yes, what do we do in phlebotomy? Repeated phlebotomy would be the answer. Repeated phlebotomy. We in phlebotomy, what do? Is we take out the blood of the patient and we give infusion. Yes, and we would transfuse the blood. So this is the only way we could take a specific amount of blood and we decrease the amount of porphyrins in the blood of that patient. Yes, and because the bone marrow is normal, everything is normal, so the amount of blood would be captured back. Yes, okay, would be thrown back into the systemic circulation. Okay, so we are not doing any transfusion, we are just removing the blood. Okay, so as the levels of porphyrins are decreased. Simple. Okay, that is phlebotomy. And over here, if the patient is reluctant or is not very comfortable to do phlebotomy, so what we would do is we would go ahead and give low dose of chloroquine. Or hydroxychloroquine. Okay, all right. And sunscreen, use of sunscreen is a must, right? Even for you and me and for everybody, using sunscreen is a must. We go out in the sun, we should make sure we are covered. Yes, okay. And that is about that. And so one advice that we can give to the patient is avoid the triggers. So what are the triggers? Yes, so probably increasing the, not to have alcohol, tobacco, estrogens, and iron supplements should be avoided. Yes, so that is all for Porphyria Cutanea Tarda. So I hope I made some justice to the topic, and some things are clear to you, and you have very clear skin manifestations, hepatic manifestations, and what could elicit these conditions and what we should not do, and about the treatment aspects as well. Okay, all right. So thank you so much for listening.